So it was a normal day, and that evening we had just been sitting watching TV. She seemed fine the whole day. I'd been with her.
And it was literally like 9 o'clock at night, just sitting there, and all of a sudden my jaw started to hurt.
And I remember she was kind of getting restless, kind of moving around a little bit.
The first thing that came to my mind was possibly, maybe I'm having a heart attack, because it's like jaw pain is a sign of heart attack in women. And I knew that I went to the Go Red event last year, and they talked about that. Nobody thinks they're having a heart attack. I'm not. There's no way I'm having a heart attack because I'm too young, which maybe I'm not, but I thought I was. And I take good care of myself. But once again, I had that jaw pain, and I'm like, this is odd.
She came up asking if I had some aspirin. I said, why do you need aspirin? It's kind of random. She's like, well, my jaw just kind of hurts. I don't know, it just feels weird. I doubt she's having a heart attack. It's a Sunday night, like at 10 o'clock. Really don't want to have to go to the emergency room. However, as I thought about it, I came downstairs and I told my dad, I said, I think you should just take her in just to get it checked out.
So I changed immediately and we left. But at that time, I thought it was just really a precautionary because I just couldn't even imagine that she was having a heart attack.
And they take me in and they hook me up to the monitors and they tell my husband, your wife's having a heart attack. And I couldn't believe that they were actually talking about me.
And by that time, they'd taken her back to her room. Then I think they realized that this was really progressing fast.
When she got to the emergency room, an EKG was done immediately per the American Heart Association protocol. And it was found that she was having an acute heart attack, an ST elevation myocardial infarction. An untreated STEMI can actually have a 50% or more mortality rate. The cath lab was activated almost immediately, and she was taken here emergently. And after a short time, we can get a patient prepped and ready, and we can look at the arteries and find the problem. In her case, one of the arteries around the back of her heart was completely occluded. But it was pretty straightforward to put a wire through that, open up the blockage, and then she got a brand new stent to keep it open. We watched her in the hospital for a few days, and because she came in so quickly, she really had no heart damage by the end of the hospital stay. She had no signs of heart failure or arrhythmias or any of the other danger signs that can happen with a heart attack, and she did extremely well.